Hello friends, welcome back. My name is Dr. Vijay Bhatia and today I'm going to talk about generalized anxiety disorder. What is generalized anxiety disorder? It's an anxiety disorder that is general and persistent. That means it is not restricted to or even strongly predominant in particular environment circumstances. That means it is free-floating anxiety. So it's persistent, it's general about everything, and it is not restricted to any situation, any circumstances. It can happen anywhere. It can happen all the time, most of the time, and it is distressing. The dominant symptoms are variable, but they often include complaints of persistent nervousness, as if feelings of uncomfortable, not right, something is wrong. They may tremble, shaking. There is muscular tension. The muscles are tense. If you touch them, they are tense, slightly rigid, slightly as if they are going to take an action. There is some sweating, especially on the forehead. They feel light-headedness, possibly because of they are breathing fast or they are breathing shallow. And there is palpitations because their heart is racing. They feel dizzy because they are not breathing comfortably. They are not relaxed. And there is some kind of epigastric discomfort. That means their stomach is churning or having butterflies or feeling of nausea and even sickness. They fear that a relative will shortly become ill. So it can be worry about literally everything and anything, even simple things about themselves, about their health, about their money, about their future, or about the family, that they will become ill. And remember, these fears are not based on actual, real things happening. There might be something minor, but the exaggeration is increased. Let's talk about their symptoms. Generalized anxiety disorder. There are certain core symptoms or core things that we need to remember. So in order to fulfill the criteria for generalized anxiety disorder, there must have been a period of at least 6 months prior to your diagnosis. And there is prominent tension, as we talked about, in muscles. You can feel in their posture, in their eyes. It looks wide, open, worried, concerned. And they talk about the worry, and the theme could be anything: their health, their money, their future, about family, about house, and it involves a number of these themes. And there is a feeling of apprehension. Something bad is going to happen. Something is not right. Something is definitely going to happen in the worst scenario. And it's about everyday events, even going to the shop, or somebody will meet them or comment on them or talk about them, or they don't feel comfortable, they feel nervous. And this has been happening for a period of about minimum 6 months. The other symptoms are autonomic arousal. Autonomic means they're automatic and they are controlled by the brain. So in the brain we have autonomic center, which is mainly hypothalamus, amygdala, and this can be triggered by your own thinking, by imagining, or by worrying thoughts, and these in turn releases adrenaline or secretes the hormones which will go to the adrenal gland and secrete adrenaline, and that causes increased heart rate, pounding of heart, accelerated heart. They will be sweating, so the adrenaline is for fight and flight hormone. So all these symptoms, as if they are preparing you, your muscles getting tense, you are literally shaking as if you want to just run away, and your mouth is getting dry, and this is not because of you are dehydrated or there is some medication causing the dry mouth. So these are autonomic arousal symptoms. Any one of these can be present and they are prominent, but a lot of the time, most of them are present, and they are present for 6 months and most of the period, and they are persistent. Symptoms involving chest and abdomen. Now, with the chest, the breathing will become difficult, shallow, not deep enough, not relaxed, or very fast, so that there is not enough time for oxygen to exchange properly or enough time for carbon dioxide to exchange properly, especially if it's gushing through the brain and not able to actually hydrate the brain properly or provide enough oxygen there. There's a feeling of choking as if they are going to die. They are not having enough oxygen. Their brain is confused. They know that doom is coming. And chest pain is there and discomfort is there. Maybe just because of the muscle tension or heart has been racing too much and not enough oxygen going to the heart. It is like angina, but it is not angina because it is related with anxiety. Nausea, feeling of sickness, abdominal distress, discomfort in the abdomen, and people will complain about churning in stomach. Remember the difference between panic disorder and the generalized anxiety disorder. In panic disorder, these symptoms are episodic, but in generalized anxiety, these symptoms are persistent throughout for a period of 6 months and sometimes even longer, years, and they make you feel uncomfortable, and these are not in acute attacks, although even though underlying anxiety is there, there might be some increase of anxiety, but other times they become too low, but they never really reach the normal, relaxed, comfortable state. That is the issue with the generalized anxiety disorder. The other symptoms involving the mental state, they might feel dizzy. It is their belief in a way rather than the actual feeling, but actually they can feel dizzy as if they're going to fall, they're going to collapse. Their feelings that objects are unreal. They start thinking, oh God, what is happening surrounding me? Nothing is real. Things are changing. I'm not the same. And if it happens to the person themselves, it is like depersonalization, that I am not real anymore. They want to touch. They want to even sometimes dig nails into their arms and feel the pain. They are not feeling the same thing. They feel as if they are changing. The fear of losing control, that they might not be able to control things. As a normal human being, you will think that your thoughts, your emotions, your actions are under your control, and if there is a fear that you might lose that control, that is a cause of concern, and going crazy, or even passing out, or even a fear of dying, which can cause extreme anxiety as well. But these symptoms are persistent throughout and normally never come to the real relaxed state. Even during the sleep, the symptoms, the person is still worrying, and that stops them going to sleep. And even if they sleep, they keep on waking up with the worrying thoughts. And the journal symptoms. Journal symptoms like hot flushes or cold chills without any temperature change in the surrounding. They just feel that they are sweating, they are cold, their body is cold, they are going pale, their lips are getting pale, their eyes are wide open and dilated as if looking for something, and they get the hot flushes and cold chills alternately, or even sometimes for longer periods. There is a feeling of numbness in their fingers or in the body in general, and tingling sensations in the fingers, which, as we described, could be because of the heavy breathing or shallow breathing, and the pH of the blood is changing, or even calcium levels in the blood are changing because of these alterations, causing these tingling sensations. Whatever the cause, the person feels uncomfortable. Muscle tension is there. If you touch their muscle, they feel tense, they feel rigid, and if you ask the person, they will complain, yes, my muscles are aching, I cannot relax, I feel pain, I feel exhausted, because the person is burning energy internally without the efficiency of it, getting the best use out of it. They feel tired, they feel lethargic, they feel they have no energy, as if they are exhausting inside. Even if they keep on eating, they don't put much weight because they keep on losing the energy. But in some patients, they keep on losing weight. In others, they keep on eating more and more as a comfort eating to help them uh, uh, cover for these symptoms, but it doesn't help. And some people don't even feel like eating because of the nausea and sickness, and they become slightly anemic, they become slightly weak. They also feel restless, as if they can't sit at one place. If they sit at one place, they keep on worrying and thinking. Even if they're sitting, they feel their legs are moving, their arms are moving, they keep on looking here and there, and in effect, there is inability to relax, and they're feeling keyed up on the edge or mentally tense. That means they can't think properly, they can't make decisions properly, their concentration is poor, they can't sit down and read a book or something because something is going on. And there is a sensation of a lump in the throat because the anxiety is so much, the muscles are so tense, the breathing is shallow. They don't feel like eating anything. Even if they eat anything, it feels like it is stuck there. And generally, they simply tell that as if I am feeling some kind of lump in my throat because I can't even talk properly. Their speech is quite anxious in tone, sometimes even stuttering, not even to explain things the way they want to explain. So it becomes very difficult, and some people actually complain of difficulty in swallowing. Other non-specific symptoms like exaggerated response to minor surprises or being startled. So they are sitting there and there is a little sound there. They get really startled. That means their muscles are getting tense, as if they're ready to fight or run away from the situation. They said, oh, you scared me, you surprised me, even if it is a minor thing. They are on the edge all the time. They complain of difficulty in concentrating. As we said, they can't sit down and read the whole chapter or the book, and their mind is going blank. That's how they describe, because they can't say the words they want to say, and therefore thinking, oh God, my mind is going blank because of the worry or anxiety. And there is some kind of irritability. That means if you even say simple things, they become irritable. Why you're disturbing me? Let me lie down. Let me just sit down. Let me watch something. And they become very irritable if the mom comes and can you have a cup of tea or anything? No. So all this, they become really irritable. Their mood is very varying, but mostly on the anxiety side, worrying side, getting tense, getting uncomfortable. As we said, they have difficulty going to sleep because of the worrying. Even if they sleep, they keep on waking up with the worrying thoughts, and then they can't fall asleep again. And in the morning, they will feel more tired, lethargic, and not able to do the things that they want to do. So it is perpetuating vicious cycle that is contributing towards their thoughts, actions, and their emotions. They are so much linked. So this is person's thoughts, this is person's emotions, and these are their actions. They are just running in a worrying way, and they affect each other, and we have to break the cycle somewhere. And normally, sometimes distraction techniques, relaxation techniques, breathing exercises, mindfulness, going for a swimming, meeting with a friend who they can talk to, confide to, help them relax, reading a good book, sometimes going on holidays will help them. But ultimately, the connection between thoughts and emotions need to be looked at by the psychologist, and possibly CBT will be the main treatment for these patients. The exclusion criteria of any anxiety disorder, especially the generalized anxiety and panic disorder, we must rule out that they do not fulfill the criteria of panic disorder. So in panic disorder, what happens is there are discrete episodes of acute anxiety, and in between the attacks, person is normally comfortable and relaxed, although slightly on the higher edge. But in generalized anxiety disorder, the anxiety is this. If this is the normal, the anxiety is normally like that, normally up and down. But in a panic disorder, it comes as peaks. So that is the difference. Phobic anxiety is mainly about the situation. If you are in a situation or circumstances, you are meeting with a person who makes you feel anxious. So it can be like agoraphobia, it can be social phobia or specific phobia to certain places like lifts, buses, or certain animals like spiders, snakes. So this is very much specific, and it is in between the periods they are fine. And normal response is to avoid these things and go away from that. That's why the word phobic. Obsessive compulsive disorder is slightly different because these are the thoughts, and these thoughts are in person's heads, and they recognize that these are their own thoughts. They're irrational, they shouldn't be there, but they keep on coming. Person don't have any control in stopping them, but they are not alien thoughts, they are their own thoughts. And these thoughts are telling the person to do something, to like shut the door, check the light, check the tap or gas, and wash their hands. So there is some kind of compulsion there for the thought come, and then they will ask to do an action, and this is obsessions and compulsions. And this could be images, this could be thoughts, this could be impulses, and normally if in a normal person we should be able to deal with them and control them, but in obsessive compulsive disorder they find it difficult. They have to keep on repeatedly going and washing their hands because the thought is their hands are possibly contaminated with some kind of germs. Hypochondriacal disorder, the person is just preoccupied that something is wrong with their body, either with their nose, or they are too fat, or they are too slim, or their leg is not right, or the ear is not good, and they go on to the surgical operations like, can you do the plastic surgery on my nose and stuff like that. The anxiety disorder is not due to a physical, so we have to rule out there is no physical disorder. Particular importance is given to the hyperthyroidism, because what happens is if there is a hyperthyroidism, there is a lot of thyroxine present, and that itself will it metabolizes in the body very quickly. So the person is losing weight, the person is looking tense, the eyes are getting exophthalmos, the eyes are protruding in some people, because if it is a long-term problem with hyperthyroidism not identified. And organic mental disorders, like even any infections anywhere, especially like urinary tract infections, and in females it confuses the mind if the infection spreads. And rule out any psychoactive substance, especially the substances which are very much like related with amphetamines or caffeines, and sometimes it happens with the withdrawal of benzodiazepines. So if the person is drinking too much coffee, too much tea, too much fizzy drinks, too much chocolates, too many other things which are stimulatory in a way, can cause some kind of generalized anxiety disorder. So one of the treatments for this generalized anxiety disorder is to cut down their tea, cut down their caffeine, cut down their Coca-Cola, Coke drinks, and learn about relaxation techniques, learn about swimming and mindfulness tapes, and yoga or some activities, drawing, painting, therapy can be helpful for these patients. Thanks for watching. Press the like button and share with your friends. Subscribe the channel for more videos on mental disorders. I see you again.